Researchers and doctors from across the nation gathered in the Queen City today for the Dementia Education Conference with a goal of finding new ways to battle Alzheimer's. Joining me right now is Dr. Heather Snyder with the Alzheimer's Association with some of the latest research and tools that are being developed. This is a disease that affects so many families, Heather.
It does. There are more than 5.7 million Americans that are living today with Alzheimer's, not to mention the more than 15 million people that are providing care and support. We know this is a challenge in this community, but in communities all across this country.
All across the country. So what kind of new tools and research is out there? Because I know we're all hoping that eventually one day we'll be able to find a cure for this.
We do, and we continue to advance research to get us to that ultimate goal, right, of being able to stop, slow, or prevent this disease. We're just coming off of the Alzheimer's Association's International Conference, which brought together researchers from 70 countries to share the latest. And a lot of that was around where are we in having a way to stop or slow the progression of this disease. Medications that are being tested in clinical trials, lifestyle, behaviors, things that we can do today that might benefit our brain health long term as well.
What are some things that people can do that might benefit them in the long run, especially if they have a history of Alzheimer's in their family?
Well, a really exciting study that reported their preliminary results at AAIC was the Sprint Mind trial that was actually led by researchers here in North Carolina from Wake Forest. And what that showed is that aggressive treatment of our systolic blood pressure, so that's the blood pressure through our body, down to 120 to the new recommendations, was also good for our brain health. We saw 19% less people develop mild cognitive impairment. So it's not Alzheimer's per se, but we need to move in that direction. We need to know what exactly is that recipe? How do we put those pieces together?
And where are we on the medication front with this? I mean, how have those improvements, how have we seen those improvements over the years?
We've really changed how clinical trials are being done. You know, we've had a lot of trials that have not seen the outcomes that we want. But we have tools now that allow us to say the biology that's changed in a person and look even before maybe the memory changes are there. Can we intervene even earlier to change the trajectory for those individuals? Possible prevention. Really exciting, and these studies are going forward, and we'll see some of them report out in the next couple years.
With the families that are out there that are dealing with Alzheimer's, either they themselves or have early onset Alzheimer's or in the early stages of it, or they have family members, where can they go for support or help?
So in communities all across the country, so if you live here but you have a family member somewhere else, the Alzheimer's Association is there for you. So you can go to our website, alz.org. It has a lot of information about what is Alzheimer's, what is dementia, what are resources, educational programs, how to find out about clinical studies that we were just talking about. And you can find all that on that website.
Heather, great information and really a positive outlook. Thank you so much.
Thank you so much.
Bill?